Hi, my name is Eleanor, and I will be sharing with you findings from a secondary analysis that we conducted from a study where we interviewed Hispanic Latino rectal cancer patients and their caregivers, and we asked them about barriers and facilitators that they encountered when navigating the complexities of rectal cancer care. So, when we were going through the primary analysis for the parent study, one of the challenges that stood out to us was language as a barrier. And the reason it stood out to us was because it wasn't lack of access to language services that was a reported barrier, but rather it was the challenges that both patients and caregivers experienced when working and communicating to their providers via a hospital interpreter. And so that is what prompted us to conduct this secondary analysis. So, for the parent study, it was a community-based participatory research study where we used qualitative methods. We formed a community advisory board and we partnered with local promotoras. And we interviewed patients either in Spanish or English, and we used reflexive thematic analysis to distill core themes from transcripts. So, one theme that emerged was the importance of dialect and regional variation. So Spanish isn't a single language, it differs by country and region. And patients pointed out that words can have different meanings depending on whether you're from El Salvador, Honduras, or another Spanish-speaking country. And this can cause confusion when interpreters aren't familiar with those nuances. Another key challenge we found is that interpreters often use overly technical medical language, which patients and caregivers may struggle to understand. We also heard about sentiments of distrust in the interpretation process, with patients and caregivers feeling that interpreters sometimes don't relay everything exactly as it's said, either summarizing, filtering, or skipping details. And so, because of all of this, many of the patients and the caregivers that we spoke to prefer to bring bilingual family members to interpret and to help support them throughout the visit, especially those who grew up in the US and understand both cultures. There's a sense that these family members can better represent not just the words, but the intent and emotion behind them. So, to conclude, beyond simply hiring more interpreters, hospitals would benefit from re envisioning the patient interpreter relationship by recognizing interpreters as active cultural mediators and not just linguistic conduits. So, future directions, we are actually in the process of developing a research protocol where we will be utilizing natural language processing to analyze the language of translation services and medical visits among English speaking patients and Spanish speaking patients. Thank you very much.